Hello, everyone, and welcome to Cellular Healing TV, episode 26, I believe. So that's 26 weeks straight. We've been bringing you real information and truth on real results, real solutions that make a difference in your life and health. I'm here with a special guest today, Dr. Jay Davidson. He's part of our inner core of trainers and coaches within our Health Centers of the Future organization, so we're blessed to have him on the show today. Obviously, our main health expert, Dr. Dan Pompa, and my co-host, Dr. David Asarno. I always call him doctor. I don't know why.
I'm not a doctor. I just play one on Cellular Healing TV.
You should. And my name's Warren Phillips. If you can't read the little banner there, I hope that you can see it. So, really exciting topic today. Dr. Pompa's gets a lot of questions, from the public on fatigue and adrenal exhaustion, adrenal fatigue. This is a big hot topic in the natural health field, and we want to tackle the truth behind adrenal fatigue and what really causes it and how to effectively restore adrenal function and obviously energy, and it affects so many things in your body. Dr. Pompa, let's get this topic started this morning.
Yeah, I always get calls, and I think I would have to say that one of the top complaints is, at least for people who've been around a while, right, in the natural health world, looking for why they don't feel well. And they say, I have adrenal exhaustion, or could it be my adrenals? My adrenals aren't right. And I have to say, they're right. I mean, typically the adrenals are, in fact, fried. They're not responding normally anymore, which can affect their sleep, can affect anxiety, can affect their energy, can affect a lot of things. But what I always tell them is that the adrenals are a downstream problem to something else, another stressor that's still there that is exhausting the adrenals. So my point is this, that most of the time the work that we do on the adrenals typically doesn't make us well. It can help certain things, but I know that when I was sick, oftentimes the stuff that I would do with my adrenals, I would have more energy, then I wouldn't sleep as well that night and literally have more anxiety at times. So it's this odd thing of balancing the adrenals. But, when I was sick, Warren, and you probably recall this, that I knew that there was something even further upstream. I narrowed it down to my pituitary, that my pituitary hypothalamus really was the big problem. And just for a little reminder for those, that sits in the center of your brain. And it sends signals to our thyroid and our adrenals, and we call that an axis. So in other words, there's communication that goes back from these endocrine glands, our thyroid and our adrenals, back to the hypothalamus pituitary. And I knew that control tower that sat in my brain wasn't responding normally. So maybe one of you all could draw a little picture, but the hypothalamus, it sits in there near the pituitary, and it receives the information. So it's the receiving part of the control tower. And then it sends hormones or signalers to the pituitary, and then the pituitary sends out signals to our adrenals and our thyroid. So I knew that something was wrong there, and I'll finish the rest of that story later on what I found out and what we did about it. But oftentimes that's the problem with many the clients that we see, is that in fact the problem is up higher in that axis of communication. But the problem can also be at the cell, right? The cell receptor to those hormones, which we talk a lot about, and typically it's both. But the adrenals are the downstream whipping boy. The adrenals get beat up with physical stress, chemical stress, emotional stress, and it is absolutely a real thing. And we'll even give you some tips on what Dr. Jay and I do to help that. But Dr. Jay, you might want to add to that part of the conversation.
Yeah, I mean, this is such a popular thing that we deal with, as far as dealing with clients and things like that. Can you guys see me?
Yeah. Well, I can click on you so you're not popping up. And Dan, if you want to accept that invitation for the Draw app, I'll do it to Jay too. I think it'll just pop up as like a little thing, and then I can start drawing for you guys.
Is it the little pencil with the mustache?
Yeah. I'll invite that when I'm. Yeah, so that will enable you to allow me to draw.
Okay.
So.
Okay.
You have one nice camera and one fast internet connection, because you're HD live, man. You look like I can see. If you had wrinkles, I could see them right now.
Yeah, well, I'd like to obviously chime in on the adrenals too, because so many people are so many people are affected with adrenal stress, adrenal fatigue, adrenal issues, but I think what we have to understand is that we have to identify with the person, okay, who actually has adrenal stress and what are some signs and symptoms. So for instance, an easy test that you could do is you could take a flashlight, go up to a mirror, shine a flashlight into your pupil, and so that's basically the dark middle part of the eyeball. When you shine a light in there and kind of shine it indirectly off to the side, when you shine that light indirectly into your pupil, the pupil should get smaller. Well, when you have great adrenal function, that pupil should stay the same size, assuming that the flashlight is at the same distance. But if you're holding it there and you see the pupil start pulsating, that's a big sign that, hey, there's adrenal stress to the body. And another big sign and symptom that I always walk my clients through and health participants is, okay, when you get stressed, do you get really achy? And how many people out there, I mean, listening to this right now, they have that type of symptom. And here's the correlating factor with that. 80% of the vitamin C that's stored in our bodies are actually stored in the adrenals. And so those people that can take just a little bit, and you know this, Dr. Pompa, can take just a little bit of vitamin C and have, a fast bowel movement, and then other people where they can literally just take tons and tons of vitamin C and they get no what we call saturation point, diarrhea at all, and those are the people that are just taxed on the adrenals. Would you agree with that?
Yeah, Dr. J, that's true. I've had people go to over 100,000 grams of vitamin C and still not have diarrhea effect, which, obviously if I do it now, I, top out at probably around 5,000. So just to give But, Jay, you're right. I remember doing that in my, doing the light test when I was sick. It looks like I'm doing it right now, doesn't it? So you can see the light coming from my left here. And we're going to look at my adrenal, or my eyes. But yeah, when you put the light on, you're going to see a normal adrenal, you'll see a constriction or, a dilation, but it holds. Well, if you're doing a light, you're going to see a constriction, but it holds and it doesn't pulsate. Mine would go zoom, 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 zoom. So that's what shows the adrenal exhaustion. And another one, Jay, is the orthostatic, which I know that you do in your office. You can just go ahead and explain that a little bit.
Yeah, so the orthostatic blood pressure, basically when you're looking at orthostatic blood pressure, is where you take blood pressure when somebody's laying flat, when they're laying down flat, and then you take the blood pressure, then when they're laying down flat, you tell them, okay, I'm going to have you stand up, but I'm going to have you stand up as fast as possible, up on your feet, and then you take the blood pressure again. And usually I like to use the automated ones just because they're really quick, and so you can get a good reading. But basically, let's take somebody's blood pressure. You have a 120/80, just kind of the typical norm, what everybody's goal always is. When you stand up, that top number should jump up about 10 points because of the different stress positions. So when you're laying down, it's obviously a lot more relaxed. When you stand up, the body should adapt because of the gravity and should raise that top number up 10 points. Now, what obviously, as you know, Dr. Pompa, the people that we work with, so many of those people, the number actually goes the opposite direction. That actually goes down. So what's the dynamics when we look at that you see?
Yeah, exactly. Once again, me as my own guinea pig had this experience, and what happens is when you stand up, your adrenals have to make that adaptation and tighten up your vessels, literally, just to raise that blood pressure. Well, why? Because it has to keep the oxygen, the blood in your brain. So literally, when you stand up and people go, oh, I feel dizzy. Okay, you don't even need the test. You're feeling dizzy because your blood pressure is dropping. Your adrenals aren't keeping those vessels tight enough, and the oxygen is not getting to the brain for that little bit of moment. So we see that temporary lack or that temporary drop in the blood pressure. Now you can almost look at it and say, okay, well, how long does it take to come back? And then that gives you even another idea of how burnt are the adrenals. But I'll tell you, Dave, I'll tell you all, I'm talking to everyone out there right now, not just Dr. J. But when I did this test too, it would be interesting because you could see sometimes your adrenals are in hyper mode. So there was times that I would do that test, and instead of raising 10, maybe 20 is a top normal, mine would raise 50. So literally, I was getting this overreaction from the adrenals, which is a bad sign too, because what was happening there is my adrenals were trying to basically respond or they're overreacting. And those are the nights that I would not sleep, have more anxiety, even panic attacks, because we were getting this overcorrection of cortisol, adrenaline, and we would see these rises. And then that would last for a little time, and then they would just get exhausted. And from that exhausted position, then I would see these massive drops in the blood pressure. So, I said that oftentimes I would treat the adrenals, they would get stronger, and I would actually start to see these higher numbers coming, but it was creating more anxiety. So, I was downstream too far trying to work the adrenals. It wasn't until I got upstream further that I was really able to, fix the problem. But there are some things you can do. One thing that I had found out, Dr. J, is Cerephos. I'm sure you use it in your practice as well. Cerephos, really, it helps taper the adrenal and the cortisol response. So it helps build the adrenals without overstimulating the adrenal. It really just controls that overreaction that I just spoke about, because that overreaction will just basically lead to more adrenal burnout eventually. So when I learned to take this Cerephos, it actually improved my sleep, probably better than anything, melatonin, all the different things I tried, because it just controlled that adrenaline and cortisol reaction. Oftentimes people get up in the middle of the night at 2 or 3 a.m., just boom, and they can't go back to sleep. It is that rise in cortisol or adrenaline, and that Cerephos can help control that. So, and it rests the adrenal. So that was one of the tricks that I had found, Jay, and you might have some others.
Yeah, well, I think you make a great point, Dr. Pompa, that when you wake up 2 to 4 a.m., that's not when you should be waking up. You should be, falling asleep. Obviously, there's different toxins, like mercury is kind of the insomnia toxin. Lead is that one where you can sleep for, at least 9-10 hours and still be tired when you wake up. But when you wake up, at 2 to 4 a.m., that means your adrenals essentially, I like to call them as firing too early. And the adrenals should start firing and they should start raising up those hormones in the morning when you're supposed to wake up, 6, 7, 8 a.m. If they're raising up too much, obviously, yeah, there's a misfiring of that. And so those are just some, I think, key points to look at. I like vitamin C. What I found is a lot of people that have adrenal fatigue or adrenal exhaustion is they're constipated. They tend to have harder stools and they don't go to the bathroom as much. And so just to define this, because I know this is everybody's favorite topic to talk about bowel movements and and bowels, but it's important, you have to understand this, is that you should have at least 1 to 2 bowel movements every day. When you have just kind of one big one, that's not always the best sign. You really want it to push more to that 2, sometimes even 3. Obviously, category for the people that go every other day, just a couple times a week, I mean, that is severe constipation. So obviously we have to define what that means. Vitamin C is an easy thing to increase because obviously, as I said, 80% of the vitamin C is stored in your adrenals, and so when your adrenals are taxed, that means your vitamin C is low. Vitamin C is a great thing to facilitate bowel movement. So when people are having harder stools or having a hard time, really getting the bowels moving, adrenals have a link with it. Vitamin C deficiency is most likely prevalent, and vitamin C helps to kind of facilitate and move the bowels. Obviously, there's other things like magnesium, probiotics. Really, most of your bowel movement actually comes from the bacteria in your gut, not the fiber that we all consume as Americans obsessed with, like the Metamucil, which has a psyllium husk in it, which, when you talk to experts like Jordan Rubin and he talks about, that actually, they're finding that actually scratches the internal surface of the intestine. It's like taking a wire brush, through the intestine. It's like, well, maybe that's not the best way to get the bowels moving. Would you agree with that, Dr. Pompa?
Yeah, no doubt. There's a lot of methods that are definitely in question, but I do love the vitamin C because you're right. It does actually, well, as you mentioned, 80% of it's, utilized in the adrenals. So, a huge help for the adrenals. So far, we gave vitamin C and something called Cerephos, which is on our website. So Warren can write that down because people are misspelling it right now as they write it. So
did I spell it right?
Seriphos.
Okay, I got it right.
It's right on the screen.
Okay, I don't see it on.
It's on Dr. J's screen right now. I've got a question for you, and I'm going to bring it back. Yeah, I got a question because let's bring it down to what is causing all of this adrenal fatigue? Now, one of the things that I see prevalent is, and even in kids these days, in teenagers especially, they're drinking Red Bulls, they're drinking Monsters. People are drinking, Diet Dr. Peppers, thinking that all these things are, it's how I keep my energy going. But isn't this a big contributing factor to what's going on with the stressors and adrenal fatigue these days?
There is no doubt about it. You want to cause stress on your adrenals, raise glucose up all day long. I mean, forget about the caffeine in there. We'll talk about that in a moment. But you raise glucose up, your adrenals are part of that adaptation to control blood sugar. So every time you raise it up, you're straining the adrenals. And then you add a little caffeine to it day in, day out. We always say, hey, a little caffeine is actually shown to be very healthy. Okay, well, that's a little. It's like after how many Red Bulls or how many cups of coffee, do you just keep driving the adrenals? So too much of anything is bad. No doubt. Too many stimulants just to stay awake. Too many stimulants just to keep your brain on target, which most children today are doing. Obviously is going to lead to adrenal burnout, no doubt. But here's the point I want to leave, and I'll let Jay respond. Look, it's always the accumulation of stressors that causes the burnout. Whether it's chemical, physical, or emotional, you've heard me say this again and again, the body's physiological reaction is the same. The adrenals are part of that reaction. So when you put these stressors together, when you have a lot of emotional stress and you have a lot of bioaccumulated chemical stress in the body, you're headed for burnout.
Yeah, and I think that's a pretty important thing that you just kind of glanced on is, the artificial basically stimulants, basically the prescription drugs. I mean, how many kids in America right now are diagnosed with ADD, which is attention deficit disorder, ADHD, attention deficit hyperactivity disorder. I probably look like I'm ADHD right now. And then you have like hyperkinetic disorder. You have obviously the autism spectrum, Asperger's. That's a whole. All those things are on that. In what we reach for in America is what? We reach for a pill first. We reach for some kind of drug to calm it down. And when you actually look at the news, it's interesting you bring this up. When you look at the news, CBS published an article. It was July 3rd, so it was earlier this month. And basically they were looking at what they were talking about Denmark research, and they were basically linking Ritalin and Concerta to rare cardiac problems were twice as likely to happen when a kid was giving that than if they weren't given that drug at all. And it's, of course, as soon as you see that, you're like, oh my gosh, I don't want to take this because it's going to double my risk of having a cardiac issue, even if I'm a kid or an adult. It links with that. But then when you start looking back in research, you'll see like 2011, New England Journal of Medicine found that there was no link. And then in JAMA, they said that there was no link as well, 2012. But go back even farther, and back in 06 and 09, they actually found that these stimulants that we give kids for ADHD could cause an increased risk of sudden death. So obviously, you'll see out in the literature, you'll see out in the media, kind of it going back and forth. I think this is why we get so confused to some degree too in our societies. Like we hear one thing, then we hear another. But you always have to keep in mind, and as you know this, Dr. Pompa, who's sponsoring it? When you look at studies in 2011, 2012 from the New England Journal of Medicine, in JAMA, most likely these were sponsored by pharmaceutical companies. And would they want to find a link between ADHD meds and heart issues? What do you guys think?
Well, of course they wouldn't. But here's the interesting thing. I would venture a guess that if you asked many of the people who were on the team that developed some of these drugs, they would never put their kids on it themselves. And I think you and I may have had this conversation. I don't remember one of our doctors in the program we did. But I mean, these are drugs that are literally changing someone's personality, and I mean it's that powerful. And Dr. Pompa, you've talked about I know we're getting off topic here, but these drugs cause a lot of other challenges as well. Besides that.
Yeah, more than that. There's the bottle of Serapos there. Okay, there we go. This is the savior for adrenal burnout. There's another product that we use called GA. It's from Systemic Form. It's capital G, small a. That one's a little easier, right? And that actually helps build the adrenals. But again, oftentimes used without something that keeps the adrenals from over-responding. It can be a mistake. So, yeah, you're right. I mean, I was stunned when I think I spoke this on one of the shows when I was at the ski camp with my kids, and how many of the kids were on different medications. Obviously, so many of the athletes, they're overtraining, overtaxing their adrenals. Of course, their body's just trying to respond and react. And what are they doing? They're masking a lot of the symptoms with medication. But Warren, I have to bring this up because I know that so many people, it's the same philosophy, right? Your dad, who we love and adore, but I still can hear him saying these words: stress. Stress is why everything, stress was the cause of everything that he had in his life. And it's kind of a nice thing because, we can almost blame stress as it's not our fault, right? I mean, it's not like your dad blamed it on stress, so he didn't have to worry about what food he put in his mouth, right? Or what he was doing, because we can't control our stress. It's just there, stress, providing for the family. Stress is the cause. Warren, you could speak to a little bit about that, because we always love to use our great fathers as great examples. Some stinking thinking, but there was one of them right there.
Yeah, I just had a conversation with my brother-in-law this morning. He's staying with us, and they're just asking questions. Maybe what should I take for this? What should I take for that? And I'm like, well, don't take anything. The pink elephant in the room, is your diet. Is toxicity. So why would you just take a pill, powder, and or lotion or a potion to get well? So that goes on the allopathic side, and on the stress side, that's how I was raised. And so much so that when I got sick, I thought, I was convinced by my dad telling me that same story of stress, stress, stress. But when I added any stress to my life, I couldn't adapt to it. So a stress like exercise, well, you hear that constantly, and we even bring it up on shows. If you're not feeling well, or you're fatigued, all you need to do is go out and go for a run. Well, I would, those nights, because my adrenals couldn't adapt to that running stress, I would absolutely never sleep on those nights. Or like Dr. J and you said, Dr. Pompa, in the middle of the night, my cortisol would rise, my adrenals would try to recover, and I wouldn't sleep the rest of the night. I'd go to sleep for an hour if I could get to sleep, and then I'd wake up heart racing in the middle of the night as my adrenal and cortisol and hormones were completely dysregulated. So the stress is a toxin, absolutely, but you brought it up, Dr. Pompa. There's multiple. The chemical stress in my life was far greater than the, actually my life was amazing at the time. I had the lowest stress in my life, no debt, a roommate, extra money, top of my game, and I couldn't adapt to any type of stress. So it wasn't the stress that was the problem. It was my inability to adapt to the stress, probably likely due to the, the chemical and physical subluxation, if you will, the chemical stress and the physical stress, meaning maybe some structural things with my neck at the time, my body not working right, and that kind of moves how, and even chiropractic can make a difference as well in some of these cases.
Yeah, and I'll let Jay speak to that, but Warren brings up a great point. See, I always say it's not the stress, it's the inability to adapt to the stress that becomes the problem. We're all under stress. How can some people be under far greater stress emotionally, and all these things going on, and they don't get sick? Well, it's because they don't have the bioaccumulated chemical stress. We always call it the perfect storm. It's when you have these three fronts come together in a perfect storm. You have a catastrophe. You have a storm that happens once 100 years, and it wipes things out. Well, that's what happens in our bodies. We have this chemical stressors that have bioaccumulated from silver fillings, all the chemicals we are introduced to, whatever. If your mother had silver fillings, that means what's in your brain, in particular your hypothalamus pituitary. Studies show that the number of silver fillings mom has in her mouth is proportional to how much mercury is found in the baby's brain. Oh, and what about the accumulation in mom's body of lead? During pregnancy, she releases that lead from her bones. It's normal to lose bone, but out comes the lead into the baby. So that's what we start life with. And then, of course, we start vaccinating. We start living in moldy homes and all these other chemical stressors. Our bucket gets full, more and more full, and then you add one emotional stress to it, bam, it overflows. Now you're not adapting. Now everything becomes a problem. Now every emotional stress, creates this absolute cortisol rise, all the hormones dysregulated. So again, it's easy to think that it's the stressor, that it's been this bioaccumulation of these stressors again and again and again. And you talked about physical stress, how a car accident, misaligning the spine can cause more stress to the central nervous system and cause that overflow to happen even more.
Yeah, I'll give you an example. Actually, just this week, a patient that basically we ran the proper test for Lyme, and she came up positive, actually really high. Lives just super strict diet, super strict and healthy lifestyle. I mean, just little things, so many things line up. Ran, for instance, a test called the micronutrient, and there was like one nutrient that she had a minor deficiency in. I mean, just very, very well laid out, but she has Lyme, and that's where a lot of her achiness is. And we were going through a few different steps, and I told her, hey, you might want to look into this technology. This can be a big benefit. And she just, boom, like couldn't handle the whole idea that there's something else to learn. And she's like the sweetest person in the world. But I look at that and I say, it's because the internal stress inside of her just doesn't allow anything that happens around her, that she just can't process it. You see this when people are in a lot of pain or they're really sick. Sometimes they can get really nasty, and it's not that that's their personality, but what you find is that just because of their body's not well, they can't handle any change, which is really a form of stress, and then it just escalates. And I think, as practitioners, we have to understand that they're just projecting, obviously, issues outward. We can't absorb them. We have to understand also details that the reality is when they're sick, their body can't handle simple stressors that most people can handle, and then it seems to escalate. And this is all about, adrenals obviously handle stress. Other things that correlate, thyroid, which thyroid you're looking at, lower metabolism, your hair, skin issues, brittle nails, basal metabolic temperatures off. So what that means is when you're in a room that's 75 degrees should be comfortable, or 72 degrees should be comfortable, you're there sweating because you're really hot, or you're shivering, you always have long sleeves on all the time. That's the body really inability to handle temperature dysregulation. And then other things that actually correlate are hormonal issues. So you're looking at estrogen, progesterone, testosterone, and I say those correlate because if you have adrenal issues, and if it's upstream, as you're talking about, Dr. Pompa, the pituitary or hypothalamus or something, upstream higher, you'll see typically signs and symptoms with thyroid issues. If it's females, you'll see signs and symptoms with estrogen, progesterone. If it's guys, you'll see issues with testosterone. Obviously, progesterone as well, too, not as well understood. But, I mean, how much in the media are we now hearing about testosterone? In where we heard, the hormone replacement therapy maybe 10, 15 years ago when it kind of came out, and then now we're understanding some of the dangers and risk of breast cancer and all these things. But I feel like on the same front now they're pushing the T, what they call the testosterone. But you want to look at, if you have these symptoms, it's not just, okay, focus just on thyroid, just on adrenal, just on these organs that produce these hormones. You have to understand this is a collective thing, that something up higher, upstream, is causing them downstream. And I think that can help most people understand that.
I think, Jason, that one of the problems, right? Most people, they go to their doctor and they focus in on the thyroid, and the doctor is only addressing the thyroid. Well, that doesn't even make sense, because the thyroid is in constant communication with the adrenals. Oh, wait, they both get controlled by the pituitary, which sits in the brain, and yet they act as if the thyroid works independently, and that's all they're treating, when really it's a whole. Oh, then we could bring in the fact that it works also with the pancreas. Oh, it works also, with other endocrine organs, as you mentioned, with the ovaries, for example, the prostate. I mean, this endocrine system is very complex, but one affects the other. The liver is affected, in this issue. I mean, we know that to address thyroid issues, you have to always consider liver function. Come on, why? Well, that's where T4 gets converted to T3. So, oh my gosh, this is getting so complicated. Yeah, you see that, the body has to be treated as a whole. To go to your doctor and, just to treat that thyroid, it's a lunacy. It really is, and I wish it weren't, we could really draw that hypothalamus up in the brain.
Oh, I
Just
can.
first to bring this full circle, I knew that there was something in that pituitary hypothalamus that controls your thyroid and controls your adrenals. Both organs were malfunctioning. My blood work for thyroid was always normal, yet I couldn't adapt to any temperature regulation at all, right? Just like you said, Dr. J. I would go outside in the winter. I would lose my hands, my feet, gone. Warren can speak to the same problem, right? And yet if I would be hot at weird times, waking up in the middle of the night absolutely drenched, hair falling out. I was young, hair falling out, all these crazy. Oh, but my blood work for thyroid was normal. That whole system was affected. But really, what I found out was it had been bioaccumulating for years. The silver fillings in my mouth were, just like studies show, the FASB study shows the number of fillings in your mouth is proportional to how much mercury they find in your brain, but in particular, your hypothalamus pituitary, which is the control tower for your thyroid, for your adrenals. How many people are downstream treating their thyroid, taking more hormones, just like Jay, taking testosterone, another hormone from a different gland? Again, how many people are taking these hormones, treating downstream when the problem is in your brain, possibly metal poisoning, possibly Lyme disease, possibly mold exposures? All of these things can affect that control tower right in the center of the brain. So too far downstream, not enough upstream. The key is getting upstream.
You know what I like? What it really attracted me several years ago now to you, Dr. Pompa, and the program in which you teach the practitioners, and what Dr. J's talking about, and it's 180 degrees different than what people are hearing out there, and it's first and foremost, you guys look at everyone and you ask the right questions to understand them wholly as an individual, and understanding what the cause of their challenges are. And as you always say, if you don't identify what the cause is and you don't remove it, you're just putting Band-Aids all over the place. And that's what most practitioners, unfortunately, do. Not on purpose. They think that they're doing well, but they just don't get to the cause.
No, listen, I didn't get well until I got that inorganic mercury out of my pituitary, hypothalamus junction. And then, magically, my adrenals started to heal. Did I need crutches for the adrenals along the way? Well, I mentioned the Serifos. This stuff saved my life. I couldn't have functioned in society without it. GA was a builder, helped me build. Systemic makes a pituitary product called GB. So capital G, small b. Makes one for the thyroid, GF, capital G, small f. Those things were absolutely part of my healing, but they would do nothing unless I removed that mercury from the pituitary. And that's something that Dr. J and I do with patients, every day. But it is imperative that you get upstream, David, and that is the point. If you remove the interference, the body has an amazing ability to heal itself. Yes, your thyroid then can start regulating. Your adrenals can then start regulating once you remove that interference.
It's all about getting the source. I was meeting with a patient yesterday, and she was talking about how her mom and her sister has thyroid issues along with her. They're on synthetic thyroid hormone, and she didn't like that, so she's on Armour. And I asked her if she had gluten sensitivity, and she said, "Oh yeah, I do." I'm like, "Well, you might want to check your Armour because now they're making it with gluten." And that's kind of a side note, obviously, but the big point is, how long are you going to need to be on Armour or levothyroxine or Synthroid if you never get to the source? I mean, how long are you actually going to need to take it? Because as soon as you stop the Armour, as soon as you stop the Synthroid, as soon as you stop the levothyroxine, which they're all just basically, thyroid hormones, as soon as you stop that, you're going to feel crummy, everything's going to tank, your blood levels are going to tank, because you never address really the underlying cause. And I think, as practitioners, we have to tell people the truth that if you don't get to the source, you can't afford to be on these 500 supplements for the rest of your life. And because you'll find this in the realm. I see a transition. I see, okay, you have the typical American, they have the prescription cabinet, then something happens, something triggers, they want to move it more to natural, so they start learning, oh, this supplement's good for this. that supplement's good for that. And then so they transition from their prescription cabinet to 500 supplements in their supplement cabinet, and then they forget the reason of why they started anything, what they're doing. They feel all lost. I mean, that's really, you know, such a big part of what you and I do, Dr. Pompa, is literally just coach and say, okay, I'm going to guide you, and this is what you need to do, and here's why, not to get lost and get chaos. But inevitably, you get a whole cabinet full of supplements, and you just shut the door, and you're like, I give up. I don't know what to do. And the reality is because we never got to the source, you know. So many people don't feel changes when they take supplements because it might have some benefit to the body, but it might be just a little piece to the puzzle. And you have to look at what's the big domino, what's the end domino. You hit that one, everything takes effect. And that's really, as practitioners, that's our goal, okay? You might have all these little symptoms, we call little, secondary maybe is a better word. You might have these secondary symptoms, but what's the main thing that's causing them all? Because once we hit, you know, that mother issue, then all the other secondaries take care of themselves instead of just going after little secondary things. What's really the upstream? What's the main source?
Well, you know, I hope everyone heard that, because, you know, I think that's just so important. Jay, that's you and I do different, right? You know, we go after that upstream source, and so many alternative doctors today, they're not doing that. They're just putting people on more of the vitamins and minerals and herbs that they like, and, you know, it's one to the next to the next. There's
IV injections.
Yeah, right, exactly. I mean, all that stuff can be fine and good, but ultimately it's never going to get you well. What gets you well is when you find that upstream thing and you remove it. Then the body heals, you know. And, you know, and Dr. J, you've heard me say this to, you know, multiple practitioners. If your patient's not progressing, if your patient's stuck, if they're still sick, it's simple. You just haven't found the upstream stressor yet. You know, and typically there's more than one, right? I mean, typically these things run together. You know, it's Lyme and heavy metals. It's mold, another biotoxin or infection, heavy metals. And these things run in these groups. But the key is, if you remove the interference, the body will heal. It will. And if you're still out there and you're still not happy with your health, you still, believe me, you still have an upstream stressor, which, by the way, keeps certain genes turned on. And if those genes are expressing this that you don't like, then you're going to stay in that you don't like, those symptoms, because your genes are literally expressing it. Well, we have to change that gene expression, but step one, if you remember the stool from previous, is you have to remove the stressor. And then we, you know, have been really trained and really good at changing that gene expression better than ever, you know, and a lot of doctors aren't even doing that. Remove the stressor, change the gene expression. You fix the cell, you'll get well every time. But it absolutely starts with trying to find those upstream stressors.
Yeah, and then the other important piece of the whole puzzle is making sure once you identify the upstream source, get the body ready to get rid of the source. Because I remember when I started going after some upstream sources of heavy metals, and my gut wasn't well, and I developed allergies to nuts. I blew up. I reacted. Because I didn't understand the process of, okay, you know, in order to detox metals, you have to have a healthy gut. But in order to have a healthy gut, you can't have these upstream source toxins, and it's basically like a dance that you have to do. Without, I mean, there's just, we could literally go back and forth, but you need somebody to help guide you that's been through it, because otherwise you can spend years, you know, you could do something, but it might be the right thing, but if you didn't do that prior step ahead of time, you might have a bad reaction and think that that wasn't the right step. And really, it's understanding that everything matters in the body. You know, for instance, the digestive tract is important, but the kidneys are important. I mean, the kidneys are what give the colon hydration. And if you're not hydrated, you're bound up, the toxins stay in you, you can't excrete them. You know, the liver, if the bowels aren't moving, the liver gets backed up. The liver is really that central focus area that detoxifies, you know, if somebody takes a prescription and aspirin, the reason they say take it every 4 hours is because it takes your liver about 4 hours to break that down and excrete, you know, half of it, the half-life they call it. And so many critical pieces of the body have to be addressed. It's not super hard, but it's understanding, you know, the basics of how the body works, what your need is. Obviously, it's always customized for everybody. We see more common things, which you would probably agree with, Dr. Pompa, but it's all customized as to, okay, where are you at? What are the tests showing? You know, I always like to say, don't guess, let's test. You know, if somebody had diabetes, obviously they're running a blood test. Well, if we want to follow up and check in on them, let's follow up obviously with the blood test. But so many times in our realm and world with toxins, there's never even testing done in the first place. And that's really, I think, one of the best things to start with is let's test, let's identify what the main things are, and then let's map it out and say, okay, here's kind of our end goal, but here's the first phases to get you into that piece. And I think once people wrap their head around it, it's a lot easier to follow through. It's a lot easier to get results because okay, here's kind of phase 1, phase 2, and then here's the big goal, and I'm going to get here. And after that, you're not going to have to rely on doctors for the rest of your life because your body's going to be well. And it's all about teaching you what you need to do so you can follow through and do it yourself.
Yeah, well said.
Great job, fellas. This is some amazing content. It's going to save a lot of lives out there. Heal the cell, get well, remove the interference. The body will heal. We're bringing real results, real truth on Cellular Healing TV. Share it with your friends. Dr. J, thanks so much for your expertise and advice. It's going to transform lives all over the country. We have thousands of people watching this show and on the repost. So your information will definitely make an impact on the world. Thanks again for your time. Dr. Pompa, as always, thank you. David, co-host, rock it out. Love and appreciate you as well. Have a great day, guys.
Thank you, guys. Yeah.
Thanks. Have a great weekend.
All right, blessings. Bye-bye.